Good evening, everybody, and thank you for attending yet another New Teeth Now webinar, where shortly we will be talking with Dr. Kirkpatrick, who has been performing the New Teeth Now procedure for a very, very long time with a lot of success. We have some exceptionally happy patients, and it is that time of year where you want that smile. You need it to look right on point so you can be happy and smiling and enjoying the holiday with your family and friends. So anybody that's on Facebook, please share and like this video. There are several people that are going to need to see it. Probably a lot of people that are going to want to contact us after they watch the webinar. Those of you that are in the webinar, I'd like to appreciate you and thank you for attending. I know it's quite late at night and you can ask questions throughout the webinar. So go ahead and make sure that chat box is working. It should be up in the right hand corner of your screen. If you don't see it, there should be an orange arrow and you can just click that arrow and it will expand. Just send us a hello. I know that there's a few of you on right now, so that we're able to answer questions throughout the webinar. How are you doing this evening, Dr. Kirkpatrick?
Doing good, Emily. Good to be here.
I'm glad. I'm very excited. What are we going to be talking about today?
A lot about implants, some special implants, and we're going to discuss some Facebook topics too.
Okay, definitely.
Like some of the different pages and some of the videos that you guys at home can go, if you're thinking about this procedure, they can actually go and watch some of the surgeries, which is pretty cool.
No, definitely. In fact, one of our patients who will watch a video shortly later on actually found you via the internet.
Yes.
And was able to contact you after looking long and hard for a lot of people that just refused to do the surgery and said it was not possible.
Yeah, and it goes to show you the power of social media.
Yes.
And thankfully she was able to find us through social media from another state and, research us and figure out that we were a safe place to come to. And it worked out really well for her because we're very happy to be able to help her. She's a really challenging case and you'll get to see her story later.
Now, in your experience, do you find that you have a lot of patients that have been other places and told, no, you don't have enough bone, or this is just not a procedure that can be done?
It seems like every day we get at least one patient who has that similar story. And to them, when it's you, then that's the main story. Even though we hear it all the time, and it's a common, common story that people do tell us that they've been to for years. Their general dentist has told them that they're really not a candidate for implants because, for a bunch of different reasons, they don't have enough bone. Mm-hmm. Maybe they want to try to keep, which. Don't take this the wrong way. I want you to, in some patients we do turn away because if you can save your natural teeth, that's by far the way you need to go. We don't have anything that's as good as your natural teeth if they're good and they've got a decent prognosis. The problem is, and I was taught this too, in dental school they taught me in years past, you do anything you can to not take a tooth out. That's kind of changed a little bit because patients are tired of sitting in a dental chair, having a tooth filled, having a tooth crowned, having the crown removed and the tooth root canal, and then a new crown placed, and then ultimately losing the tooth a few years later. So now you spend a lot of time, a lot of money, sometimes a lot of pain, and there's an easier way to fix that now. So
if you're missing several teeth, or you've been struggling with a denture, something that's removable, constantly coming in and out of the mouth, this would be a procedure for you.
This would be a great procedure for you. People who have, they're either missing all their teeth and they have a denture that they're not happy with. And if you have a denture, that's you. I've never met a patient that's truly happy with a denture. A mouthful of bad teeth or a mouthful of just severe periodontal disease. And that's basically the three main types of patients that we see. And there's help for all three of those. We can do this procedure on, I've done on patients who've had dentures for 40 years and very, very little bone and who've been to multiple other dentists, dental specialists, even other oral surgeons who've told them that, sorry, you just don't have enough bone without doing some type of aggressive bone grafting procedure, which may or may not work. Now we're able to treat that patient and do it in 1 day.
Wow, just a single day. So anybody that's watching, I'd be interested to know if you yourself are struggling with a denture. If you are and you're comfortable leaving a comment, let us know what is the most bothersome thing with that denture. A lot of people complain of the glue, a lot of people complain it's just too big.
The loss of taste.
Right.
Bulky, speech problems. I mean, the list goes on with a plastic denture.
Definitely. So feel free, leave a comment or even send in a question and we can answer it on here. We actually have like a little denture shown here. So is the palate that covers the roof of your mouth, is that what prevents people from being able to taste? Or what is it?
It's... So we had, just to give you a little brief history of, this is an upper denture. Let me flip it up this way. So that's the teeth. This part here would cover the palate or the roof of the mouth. So you can see how much of the mouth is covered. And it has to be this big to suction up against the roof of the mouth. Otherwise, there's nothing there to hold it in. And, the sad part about that is a lot of people, you lose that suction over time because you lose bone.
Okay.
Because there's not tooth roots in the bone anymore and there's not a dental implant there. So this suctions up, and as your bone shrinks, there's less material less gum basically for it to suction to. So people have to put the glue on or the adhesive. And that I do really feel bad for the patients that have to do that because it does affect taste. It's gooey, taking it out, you got to clean all that stuff out. And, with the patients that we've seen that come in, they've been wearing a denture for years. And a lot of those patients have been told that you're not a candidate. Like you don't have enough bone. You've had a denture for 40 years. You've lost all this bone from not having teeth, and you don't have enough bone for implants. We can fix that now. And with the New Teeth Now procedure, every case that I've done, it's been still in 1 day.
Right.
So it's something that can be done. Some cases are more challenging than others, but we can help you get... Sorry, Ted, I was fast. We can help you get rid of the denture and into something like this. And if you can zoom in, if I can hold my hands still enough. So this would be the implant bridge that's screwed into implants. And you can see the 6 holes, which is how I do the upper. There's 6 implants on the top. And it's holding this complete implant bridge that's screwed in. It never comes in and out. You don't need adhesive. It just kind of rests right on the gums, and it's secured by just the implants. So it's fixed in the mouth. It's as close as you can get to having your natural teeth back. Where it's compared to this, it'd be like saying, well, I've got to go to, I'm driving across the United States. You can either take a really nice car or you can take a bicycle. Both are wheels and they will get you there. But there's a big difference in, how comfortable they are and how you are actually getting there.
That's a great analogy. I like it.
I thought it was cute, but...
Yeah, no, it was good because it's true. So let's have a look at this slide because this kind of explains what an implant is. It's replacing the tooth root, and that's what's securing the New Teeth Now design into the patient's mouth.
So let me see if I can get my mouse working. So the yellow is representing the bone. The screw-looking material there, that is the actual implant. So a dental implant purely replaces the root of a tooth and gives either your dentist a foundation to put a single crown on, which is the part you see and use, or us a foundation if we put, 4 to 6 implants in, to put this fixed bridge that would replace everything in one jaw. And when I say 4 to 6, it's my 99% of my cases are 6 implants on the top and 4 to 6 implants on the bottom. I try to put in as many implants as I can to give you as much support as I can, as long as we can evenly space them out. More implants is better if they're spaced out, but more implants are not better from the bridge standpoint if they're too close together. And if you could zoom back in on this so you guys can get an idea of what I'm talking about. If you have implants that are too close together and you have to put more of these silver, they're titanium cylinders that basically are secured in the bridge that get attached to the screws. If they're too close together, then you don't have a lot of zirconia or the material in between those cylinders, which can make a weak spot in the bridge. Mm-hmm. Which the whole reason for doing the procedure is so you can get this bridge and have a strong bridge. So from an implant standpoint, the more is better. From the bridge standpoint, more is better when they're evenly spaced out. And that's how we determine how many implants we put in.
And we do have a question that just came in asking about how to maintain and clean these sort of teeth.
Sure.
Since you cannot take them out.
So that's a great question. And it's an easy answer. You treat them like you would natural teeth. Well, you treat them better than you treated your natural teeth. Otherwise, you'd still have them.
Right.
But going into this, you brush them just like you would natural teeth. And every 6 months, you still go to the dentist and you have your teeth cleaned. Except when you have these cleaned, it's a lot easier than how it used to be with natural teeth, where they'd go in, the hygienist would scrape around each tooth. The dentist would go in, unscrew this, take it out, take it in the back, clean it, steam clean it, get all the staining off, any plaque and calculus that accumulated, because plaque and calculus, it's normal for that to occur in your mouth, and it will adhere to these just like it does natural teeth. So you got to go get that professionally cleaned.
So whatever colour they pick for their final teeth, because even though it's a one-day surgery, there is a process which we'll kind of talk about, is the colour that they're going to have for the rest of their life.
Yeah, for the most part. I mean, they do, every material, can stain. So if you are a heavy smoker, a heavy coffee drinker, like me, a heavy red wine drinker, then, any grape juice, stuff like that will stain natural teeth. But when I go to the dentist and have a cleaning, they do the polishing at the end, and, pretty much all the surface stain comes off. The same with these. When you go to the dentist, they'll stain like natural teeth. Actually, a little less than natural teeth because of their zirconia. So they don't stain as bad. But the cool thing about it is when you go to your every 6-month cleaning, and one of the general dentists that we work with a lot, Dr. Nafali's got a great way. I heard him tell a patient that, you brush your teeth a couple times a day. That's like you're washing your car. Every 6 months you're coming to me, and I'm going to take your teeth out, and I'm going to detail them for you. So it gets them looking like back to new. So he gets that new polished surface back on. The steam cleaner gets all the surface stains away, and then he screws them back in, and you basically didn't set through anything except having the teeth unscrewed and screwed back in, which there's no pain with that. There's no numbing medicine, no shots. It's just, that's as easy as it can be.
That's incredible. So how white do people go?
Oh, as white as you want. I mean, they're your teeth. I like a natural looking tooth, but I would want a really white tooth as well. So you pick your color, which is one of the benefits of the procedure. You actually get to pick the size, the shape, and the color of the teeth.
Well, we do have another question, and it's talking about bone grafting procedure. So I'm going to bring this up because I know your answer to this.
Okay.
I believe that what they're asking, and if it's incorrect, please send the question in again, is it as strong as grafting, or is it better to put the implant in a natural bone?
I'll answer in a couple different ways, and hopefully it does hit what you're looking for. So anytime you can put in an implant into your native bone, that is better because that's your bone and not like a grafted bone.
Okay.
So implants are successful. I'm not saying they're not successful in bone grafts. But in my hands and the way I see, hundreds of these patients go through the procedure, if I can put them in your native bone, then that usually heals better with less potential complications and problems. If the question is whether the implants will replace where patients have had bone loss and like sunken in face appearance, and then yes, the implants would also help fill in volume and replace lost volume from loss of bone without having to do bone grafts.
Mm-hmm.
And I still do bone grafts, a lot of them, because if you're missing, one tooth in the back part of the upper jaw, and your sinus has dropped down some and you lost some bone, you need a sinus lift and bone graft, and you still have to do that. But when you're talking about replacing everything in one jaw, we don't have to do that anymore. So you don't have to go through the sinus lift, the bone graft, and the 6 to 9 months for the bone graft to heal. And if enough bone takes,
mm-hmm.
and we've seen a lot of patients from other providers that, they've had not just one, but 2 or 3 sinus lifts and bone grafts to try to get traditional implants in for something like this, that if either the graft got infected or enough bone didn't take and they had to graft more bone, or I've had cases where you look on an x-ray and there's a massive amount of bone,
mm-hmm.
but you screw an implant in it and it never gets tight. It's just really soft bone. It never totally healed.
So would you say that you've had less complications with the new teeth now procedure than you have in single tooth cases that have required sinus lifts and bone grafting?
You can't even compare it.
Really?
Yeah.
Wow.
It's just taking that, any potential complications from a bone graft, it just completely takes it out of the equation.
Mm-hmm.
So now you're dealing with what can possibly happen to an implant, and an implant can fail. I mean, people talk about, how, are they going to last me forever? Well, they should. They're designed to do that. But an implant can fail. Thankfully, they're even across the United States, with every provider, from a general dentist to a periodontist to oral surgeon, implants are 96 to 98% successful.
Mm-hmm.
Here, I think we're a little higher than that consistently, because we do. I mean, it's what we do every day. It's basically the way to say that. But.
And how long have you been doing dental implants for? I don't want to reveal your age on camera, but
here with this practice, 11 years.
Wow.
Total 15 years.
And
so,
back,
it's been a while.
When you were learning it, has it changed? Has it developed more, would you say?
I think the materials, not necessarily with the implant itself, but the connections and hands down, the material that the bridge is made of
mm-hmm.
has dramatically changed and gotten probably better than what anyone in our specialty could even imagine that it could be.
I know that a lot of companies upcharge for either a Zirconia bridge if they're capable of, molding it out of Zirconia,
sure.
because obviously it's a specialized material. You need specialists to
mm-hmm.
even paint and, work with it. And as far as your experience, you learnt how to do a special type of implant back in school called a zygomatic implant.
Yes.
Is that correct? Talk to me a little bit about those.
So and that's one of the things that we were talking about when we first started the webinar tonight.
Mm-hmm.
So with people who have been missing, and speaking about the upper jaw only, people are missing a lot of bone. It's usually in the back part, and it's where the sinuses are located. And what happens is you take out teeth, or you have periodontal disease, and you lose bone from the mouth side, from the gum side. Well, then your sinuses can drop as well. So if you think about if your sinus is here
mm-hmm.
and your gum level bone is here, if this shrinks this way and then the sinuses drop, it's just kind of like pancaking on top of each other. So it becomes really short bone. And you need a certain amount of height for an implant, for a regular implant. And it's really common for people to come in and have pretty good bone in the front and in the side, like where the canine teeth would be located, and in the back have like a millimeter, like paper thin bone. But with that, if you can do zygomatic implants, then that's a typical case for us. We use zygomatic implants. They anchor into the lower part of the cheekbone, bypasses the area where you don't have a lot of bone, and that's what negates the need for the sinus lift and bone graft, by bypassing and anchoring it into the lower part of the cheekbone.
Let's take a look at one of our slides.
Yes.
Because this is one of your patients, and I love how happy she is in this picture. And then obviously to the right is what's in her mouth.
Mm-hmm.
Is she wearing a denture?
So she has a denture here.
Yeah.
And she was told she had gone to a lot of different places just to try to get help, see if there's anything she could do to get rid of her denture. And she tried. You can look on her lower. She's got these 2 implants that they're failing, but she was snapping a lower denture onto those 2 implants.
So she
and it
lost
helped.
So much bone that she ended up having to try and find alternate methods such as the snapping.
Yes. And because her denture didn't fit on the bottom, it was starting to really not fit on the top. And she had been told, pretty much that there was nothing that she could do. Not even bone grafts were an option for her. And so she came here just to see what we had going on and what we could offer. And we were able to put in zygomatic implants in her upper jaw, traditional implants in the lower. She still had plenty of bone in the lower. And that's her with the fixed bridges. So nothing covering the roof of the mouth. No wings or like the saddle-shaped denture setting on the lower jaw, and no wings going up and underneath her upper lip or cheek area.
And it's like you've restored her entire jaw. She looks like 30 years younger.
Oh yeah, and she feels
That's incredible.
She feels that way because now she doesn't have to use denture adhesive, and she can pretty much eat whatever she wants and
She's even
not
done her hair
worry
for
about
the
her
next
teeth.
picture.
Exactly.
Look, she looks great. And if we keep going, we've got another one.
Yes. So this lady came in from another state, and this is one big bridge that is failing, and she too had been told that she didn't have enough bone for implants, mainly in the back part of the upper jaw. So here's what the zygomatic implants are, and this is her afterwards. This is about a couple weeks after, and you can see, she looks great.
She does.
And beautiful smile. And by the way, she picked that. So you ask how white can you go with your teeth? That's about as white as you can go. But I think they look beautiful on her.
Oh, they definitely suit her.
And, she had really good bone in the front and in the middle part of the upper jaw. Here, these big dark areas, that's her sinuses. And you can see they just drop right there and here. So her bone goes from this thick to this thick in the upper jaw. These are the zygomatic implants. We totally bypass that and anchor them into the lower part of the cheekbone. They look just like a regular implant in your mouth. Even a general dentist can't tell by looking at the implant. They look funny on an x-ray because you can see that. But because they're longer and they go in different directions, the recovery is essentially the same. So it's a very big advantage for me as the surgeon to be able to do this in one day, and for you as the patient to be able to do this in one day and avoid the grafting, avoid the time for the graft to heal, and get fixed teeth.
Right. And we've had a lot of questions, which I'm going to address shortly, but about pain. And, since it's done in one day, you're coming in the morning, you're having the surgery done, you're generally done within a few hours. Am I correct?
Yes. So typically it's around 3 hours. And it is, even me, I think that the patients should go through more pain than what they go through, because I know the amount of work that I've done.
Right.
But very surprisingly, and not so much anymore because we've been doing this for 11 years, but we give out, pain medicine in case you do have pain afterwards. But it is really common for a patient to come back. And I would say the vast majority of our patients come back and say, man, I took one pain pill before I went to bed that night because I thought I was going to have pain and I would need it. But the next morning, I didn't really take any. I just needed Advil or Tylenol, and never really had pain. You know, there are exceptions to the rule. Everybody's not that way, and you know, there's some people that do have a lower threshold for pain than others, and they do need that. But that is pretty typical for patients to come back and tell us. What I will tell you, the most common, you know, if there's a complaint after, it's if a patient does get swollen, they're just uncomfortable with the swelling, you know, and that's, you know, that's part of the recovery. And they'll say, you know, I really didn't have pain. I just didn't like that feeling of being swollen right here.
It reminds me of, and we're about to watch a video with Bethany in it, your patient, who was a younger patient. And I'm pretty sure she goes over her story a little bit, but she'd had a denture since a very, very young age. And she made a funny Snapchat, which is another social media platform for those that don't know, about looking like a chipmunk after the surgery. Now, she was in no pain because she was laughing the whole time that she did it.
Right.
But she did mention about the swelling. So let's watch her video because she did have zygomatic implants also. Let's watch that now.
I had looked into dental implants before, but I had so much bone loss from having dentures that it just didn't look doable for me anymore. When I was 8, I got dentures, and it looked awful.
And the longer you have a denture, the more bone loss you have. And when you have a lot of bone loss in the back part of the upper jaw, you either have to go through extensive surgery with bone grafting, and you let that bone graft heal, or you can use zygomatic implants and kind of do everything in one day. We're able to put 4 across the front, and then the 2 zygomas in the upper jaw. And on the lower jaw, I typically do 4 implants for the entire bridge, but she had enough that we could squeeze in 6. It's a great feeling just knowing that in one day make that big of a difference in a patient's life. Our girl, we all want to see.
Okay. Oh, wow.
They look good.
They look so great. I'd say there's definitely hope. If you think that you can't have dental implants, like obviously you definitely can. Now, thanks to Dr. Kirkpatrick, I actually feel free to smile freely and I can eat whatever I want.
How cool is that?
Yeah, I love that video. That's amazing. That's the first time you've seen it.
That is the first time. Yeah, you know, off when the mics were off and the video was playing, we were just bragging on air. You know, our team of specialists that put this thing together, and I mean, I thought it looked really good. And Bethany she's an awesome person, and we're very happy to be able to, you know, take a person like that who, she didn't really do anything wrong. It's just the way she was made that, you know, she had that problem and lost her teeth and had, you know, no kid should really have to have dentures.
No.
You know, and unfortunately, you know, it's not common for us to have a patient like that, but you know, you can't really put implants in until you've stopped growing, because an implant can't move and it can restrict growth of the bone. So you've got to wait until you are, you know, for a female around 17, 18 years old. But for her, to be able to take her, who has had a denture, pretty much, that's all she's known. Bad teeth and a denture.
Dentist appointment after dentist appointment.
With nothing to do except basically take a tooth out.
Right.
And put her in something that is screwed in and fixed. And I don't know if that, because we can't hear the video if she mentioned her fangs, but when I say like everything's custom, you know, like you get to pick out what you want your teeth to look like from the size, the shape, the color. Well, she wanted her canines to be a little longer, a little more pointy, like fangs, and we were all kind of against that, but we compromised and gave her little fangs. And she loves them. You know, she absolutely loves the appearance of her teeth. And
just to interrupt, anybody that is interested in Bethany's story or wants to ask her questions directly, her YouTube channel, I think, is Bethany Wilhelm, Wilhelm. I think it's great to go watch because she talks about her journey. There are videos on there of her, you know, searching for companies like that Dr. like New Teeth Now, where Dr. Kirkpatrick assists, and she stumbled across us, and I think we were one of her last hopes too, because she had a lot of bone loss, zygomatic implants, again from a disease that is not her fault, very much like periodontal disease. Now I know Bethany didn't have that, but it's another disease that is genetic.
It can be. It's either acquired,
Right, from lack of brushing.
Yeah,
Yes,
lack of
and taking care of them.
diet, and a lot of things can contribute. But periodontal disease, it's one of those things that what makes it so bad is that most people never know they have it, especially if you don't go to the dentist. It's one of those things that can be painless, and there's no real symptoms from it. Some people have pain, some people don't, most people don't. Some people have a little bleeding when they brush, some people don't. So it's one of those things that if you're not looking for, you may have, and it can be serious. I mean, there's a lot of studies that have been done years and years that connect periodontal disease to a lot of other organ systems in the body. And one of the hospitals that I cover here in Lakeland, I do a lot of facial trauma, but the other thing that we get called to the hospital for, and fairly common, from the cardiac surgeons. So they'll have a patient that is sick, needs a heart valve replaced, and that surgeon will not do that procedure, a potentially life-saving procedure, until we clear them from a periodontal standpoint. Because they know that if they go in and put a prosthetic valve in the heart, and that patient has bad periodontal disease, that the bugs that cause the infection in the gums can get to that heart valve and cause an infection and basically ruin the procedure that they just did. A big open chest procedure. So it is a very serious disease that even, primary cares are doing a really good job now of, they're not just kind of, open up and sticking the popsicle stick in and say, they're really looking at your teeth, your gums, and that's good. That's great for patients, because if they see red bleeding gums, swollen gums, they're going to really push you to get in to see a dentist and get that taken care of. Because, if you could put this slide up, it does, this is basically it. And here's the connection. It increases your risk of heart attack, stroke. For women who are still of, age that they can have babies, diabetes, osteoporosis, respiratory diseases, digestive diseases. And what it all comes down to is just a low-grade chronic infection that your body is constantly fighting. And it really doesn't matter if it's an infection on your knee or your toe, or the longer you have that and the longer your body's fighting it, your immune system's working and working hard. And that can shorten your life expectancy.
So you've seen a dramatic improvement in people's health just from doing this procedure.
Oh, we hear it all the time, and that is a very cool thing to hear, that a patient will come back and say, I've had diabetes and just such a hard time controlling my blood sugar, just the highs and the lows. And since I've had this procedure done, it's just easier for me to control that. And it's because the infection's gone.
Which makes sense.
You take that infection out, which does affect your body's sensitivity to insulin, and it makes a big difference. And I've had a lot of people come in and tell me that, man, I didn't even know I felt bad until I had this fixed. Now I feel so much better that, I don't know how I was going for years like that.
So if somebody has been told they have periodontal disease by their general dentist, they do go to their regular visits. I know that a lot of people watching may not even visit the dentist out of fear or anxiety, or just, I understand.
Yeah.
But if they've been told they do have periodontal, do you think that this is something they should potentially consider?
Oh, by all means, at least come in for the consult.
Right.
Because you're not committed to anything. It's just, you will sit down with one of my implant coordinators. We'll get a CT scan of your face, and then you and I, you as the patient and me as a surgeon, look at your CT in detail, and we go over exactly what I have or what you have, and how I can fix that. So exactly what I'm going to do to you. and how we can get you to your goal of, you know, happy, healthy gum tissue with fixed teeth to eat with.
And right before the holidays too.
And right before the holidays.
It's
Absolutely.
perfect. You've got something
And now's
to
a
look
great
forward
time to do it.
for the new year.
Yes.
New year, new you. That's what everybody says.
Absolutely.
And
That's
how
it.
can you be a new you if you can't smile? So you don't only do dental implants. You
No.
also do, as you mentioned earlier, the trauma for Lakeland Regional, facial trauma. And I've seen some of your work that isn't for trauma, but just to make people feel and look good.
Yes.
Can we take a little look at your list
Yeah.
of things
So,
that you do here?
you know, another part of my practice is just facial cosmetics. And, you know, that would consist of pretty much everything you see here. The Botox and fillers to augment like the lips and help with wrinkles in the forehead and around the eyes. But chin and cheek implants, it's something that a lot of people, I think, overlook. That's a really good way of replacing volume, especially in people that are having the new teeth now procedure. Because those patients have lost not only the bone around the teeth, but they've also lost bone around the chin and then the cheeks, and the face sinks in a little bit. And we can replace that volume. Not only replace the volume with the teeth, but augment the chin and the cheeks and fill them back out. And it really can take the patient back 15, 20 years really easy. Brow lifts, eyelid enhancement, face and neck lift, and rhinoplasty, so nose surgery. You know, all those are part of my practice, and they can be, a lot of them can be done at the same time as the implant procedures, or they can be done totally separate. You know,
I love
so
it.
it's just a part of the practice that can help patients look and feel their best.
I really want to look like Maleficent.
Maleficent,
Yeah,
those
she's
are
got those
big
high
cheekbones.
cheekbones. Do you think you've got some cheek implants that would?
Oh, they're special ones. We can custom.
All right.
We can custom make them.
I appreciate it.
And,
Well,
you know-
we've got some before and afters here.
Yeah, and talking about the cosmetics and Bethany's story, and for those of you that are interested, you know, with social media, we have a couple different social media sites where you can actually go and watch, if you know, for those of your stomachs that can handle it. On Facebook, it's the Face Doc on Facebook, and you can go and watch some of the surgeries that.
Is it the Real Face Doc on Facebook?
It's the Real Face Doc on Instagram.
Okay.
And the Face Doc on Facebook
And then Snapchat, if you have that.
is the Face Doc.
Yes.
And that is pretty much all three of those social media platforms. You can go and see pretty much every procedure that we've talked about. And it's not one from a library of videos. It's me doing it on my patients here. And it's so, and a lot of patients really like to see that. And that's why I wanted to talk about that, because I've had patients tell me, and Bethany is one of them, you know,
Yeah.
she watched a lot of the procedures. She knew exactly
As soon
what
as
was
she
going
came
to happen.
out of surgery, she was online trying to look up her videos.
Oh yeah, she wanted to. We did record hers,
Yeah.
and we don't record everybody's. You know, you consent for that if that's something that you would want. But she wanted it. She wanted to watch herself, and she had watched a lot of videos before she even came to Florida, so she knew exactly what we were going to do, and it made her feel more comfortable.
Definitely. I was going to say, I
Because-
feel like it's reassuring.
Yes, she knew how professional it was, how good we are, you know, and I've had people tell me like, oh, you record these and put them on social media?
Yeah.
Like, aren't you scared somebody's going to see something? And I'm like, yeah, they're going to see how it's supposed to be done. You know, and that's, you know, we're not hiding anything. I feel like that we do everything as good or better than it should be done. And you get to see that.
As long as
from
you
start
sign
to
the
finish.
consent.
Yeah, well,
That's
no, I'm
pretty
talking about the ones
important,
that have been done. Yes. Yes.
Let's take a look at this before and after, because I love this one. We showed it a little bit earlier.
Yeah, and this is
They
one.
look like two different people.
They do, and you know, she had the new teeth now procedure with removing everything in her mouth and putting in new implants, but she also had at the same time a CO2 laser resurfacing of her face. So if you look at the after, she's glowing. She's got that shine to her skin. The fine lines and wrinkles have significantly decreased, and the sunspots have basically disappeared.
Mm-hmm.
And this is about 2 weeks after, and that's a dramatic difference.
That is incredible. Like I said, I thought it was two different people. Obviously, there's similarities, but you think that we're like, don't you call them sister?
It's like her younger sister. Yeah. Yes, yeah.
And then this is a good one too.
Yeah, this is a good one. It's just, and this is just, she did not have the new teeth now procedure as purely a cosmetic case, but just the jowls and the neck. So she had a facelift, which treats the lower part of the face. So her jowling, the wrinkling here, beautiful neck. If you look at the banding here, that's nice and smooth. Looks great.
And it just takes years off. Just that one area. You would never know.
Yeah.
But it really does just put everything back up where it's supposed to be.
It does. And then here's another, and I hope you people at home can see that none of these patients should look like they've had plastic surgery.
Mm-hmm.
So I still want you to look natural and not have a wind tunnel, like your skin stretched so tight you can't move. I want natural, but extremely rested and better. This is a brow lift, face lift, and neck lift with liposuction. And it's just, when you see from the side, that is a dramatic difference.
Mm-hmm.
And, she was very, very happy with the outcome. Another, CO2 laser resurfacing, which can easily be done at the same time as the New Teeth Now procedure. And then this is a chin implant. And I love this picture. So this shows the dimpling in the chin because she's struggling to close her lips. She can't because her chin's set back. So just by putting a silicone chin implant, it takes about 30 to 45 minutes. Now that's gone, and it just fills out where she was deficient.
It's funny. I had a young girl that I work with outside of New Teeth Now, and she was complaining of the same thing. She said, it's uncomfortable to eat. She feels like in pictures it just doesn't look right. But she's also scared to get a chin implant because she's scared it's going to look wrong or too much. And I told her to check some of your videos out on Instagram at therealfacedoc.com.
Yes.
It's therealfacedoc, right?
Yes.
Therealfacedoc on Instagram.
And we can try to put those up somewhere on the webinar or the Facebook page. We have an alarm.
Sounds like it. Sorry if it's
No, it's not. So,
interrupting.
what I would tell somebody that's needs it, wants it, considering it, scared of it, the really cool thing about like a cheek or a chin implant is there's so many different shapes and sizes. So we have sizers here that we pretty much overlay on the skin, and that kind of mirrors about what you're going to look like. And worst case scenario, if it isn't what you want it to be, or maybe you wanted it bigger, or maybe you want it not as big, it can be changed out.
Really?
Yes.
And it's just a 30-40 minute procedure?
Every time.
Wow.
Now
That's awesome.
I've never had to go in and change one out.
That's good to know.
So yes, so I feel like we got a pretty good idea about what we're looking for and trying to get to.
I know on your Instagram you also have a rhinoplasty before and after.
Yes.
We need to add that to one of these slides eventually.
Yeah.
I agree. Do you feel like there is anything else that we need to go over as far as the New Teeth Now procedure, the cosmetics? From
a surgeon standpoint, I would just a last message. I would just say if you are on here, then you're at least thinking about like the New Teeth Now.
Definitely.
And you've taken time out of your day to spend with us, and I know there's like basketball games on and other things that you could be doing, Christmas shopping, but if you're considering it, just call and come in for a consult. And, at least sit down and know your options and how we would do it. And it's not a scary thing at all. The consult is not scary. It's something that, it's a very, low stress situation. We're just casually talking and figuring out what your goals are, what your complaints are, and how we can get you to achieve those.
And the consult is just a $50 prepay, which we do take over the phone. It includes an hour appointment. You are going to be sat with a coordinator and Dr. Kirkpatrick himself. He is going to sit in there, like he explained earlier if you missed it, and talk to you about the x-ray, explain to you every little detail. Your x-ray is not going to look like mine. Mine isn't going to look like the next person. Everybody's going to be different. And if this is a procedure you need or is something that you might need in the future. So I know that the CAT scan and the machine that you use here at New Teeth now, people are charging like hundreds of dollars just to get an x-ray.
Yeah, they are. It's typical to...
How are you able to discount it to just 50? Is that just because of the amount that you're doing?
We do a lot of them, and we own the machine.
Right, that makes sense.
Yes. Even though the machine is very expensive, but we own it.
Okay.
And it is a tool that is, in my opinion, it's irreplaceable when you're trying. And that's a good point. Because I've had patients to tell me, even yesterday, I had a patient come in for a consult, and at the conclusion of the consult, I'm shaking their hand, nice to meet you, and and if you have any other questions, come back in. You're more than welcome to come back and talk to me again. And they said, well, I just want to tell you one more thing. You're my third opinion, and I'm going to come here. And one of the reasons is because of the amount of time and how detailed you went in to explaining what you found on the CT, showing me the CT, and what you would do with the implants. And I was like, oh, well, thank you for those comments, but that's the way I would want it done to me. Because the more you know as a patient, the happier you're going to be. Because you're going to know what you're getting into. You're going to know what I'm going to do to you, and you're going to ultimately be happy in the end, because there's no surprises.
Right. No, it makes perfect sense, and I think you nailed it when you said that this is their third opinion,
yes,
and they're going to come to you, because you have that a lot.
Yeah.
That...
Fortunately, we are blessed.
Or
in
if
that
we're
way
the first opinion,
yes,
we end up being a secondary opinion just to confirm everything because they went somewhere else.
Yes.
So on the screen here is Debbie and Shauna, and the reason that I want to show these two wonderful ladies is because they are going to be the two people that you're going to sit with to begin with. And it's always nerve-wracking. We've had patients that have never even come into the lobby. I used to have patients hang up on me before they would book the appointment. It's a very sensitive topic, and it's something that is going to improve your lifestyle immensely, your confidence, the way you look, the way you eat, what you eat, and it's just good to have that familiarity. So also on this next page you've got Dr. Nofala and...
Yeah, we'll go back to that.
Well, there's the team. There's Dr. Nofala. Very important, get familiar with his face because he's going to be the one deciding, colour, size, shape. He's the artist behind it all. Not that you're not.
He's very good at what he does. And then this is my team. We're minus one of those, and we added two more who are very good as well.
Well, we will be updating that then.
Yeah, and that's a recent change, so it's a good change.
That's impressive. So, we also have anaesthesia on site, which is Jack and Kim. You will go over all of this in your consultation. Here is a giant picture of the entire team. There is a lot of people that go into this. You have built an incredible team here with Dr. Richards. And originally Dr. Musser, who helped start it all out. And together you've just created this amazing environment that I think welcomes people and, like you said, gets the last opinion.
Yeah.
I mean, that's all that is to be said, to be honest, because I have yet to find somebody that's had an opinion from you that hasn't come to you.
Not that I know of.
Right.
Yeah.
You have a lot of return people. And it's good to go out there and investigate, get second opinions. This doctor right here will tell you that. Get opinions from everywhere.
We do have, just an added comment, we do have patients that voluntarily want to talk to people that are considering this but are hesitant to do it. And that have gone through the procedure, they're in their final teeth, and they have loved the process and their result so much that they have, openly given out their phone number. Just like, hey, if you have anybody that is considering this and wants to talk to somebody that's gone through it, I'll tell them everything.
Well, look at the ones that want to be on the camera.
Oh, yeah.
Meet Ted, and you'll meet Ted and all of our camera crew, and we've got Jason here. Like, literally, it's a small company, but with a lot of people that you get to know on a personal basis, definitely. Yes. Thank you again for answering all those questions. And thank you guys for attending. Be sure to like and share this video, leave us any comments, and we'll see you again soon. Bye.